Okay, so this is station 15. This is a case study which is saying a pregnant woman with a blood pressure of 160 over 110 with proteinuria complaining of a headache. Then one, what is the diagnosis? Two, mention other symptoms she may uh, present with. Then question three, mention three signs. Question four, mention four investigations. So even though we have not been given the exact proteinuria, but this patient is presenting with a headache, which will give you it will give you a hint. So this is a case study on SPE. So the diagnosis there is a severe preeclampsia. So we have done the diagnosis, severe preeclampsia. Then mention other symptoms the patient must present with. So other symptoms the patient must present with will be abdominal pain, can have a visual disturbance, can have oliguria. So patient will tell you that actually it's been a while since I've actually gone. I've felt the sensation of the sensation for me to go and urinate. Then the other is on the symptoms the patient might present with respiratory difficulties breathing. Then the other is can also find the patient who have swollen legs. Okay. Then in terms of signs, will be right upper quadrant tenderness. Then when you do your own, since the patient said their legs are swollen, so for you on your sign you can check if it's a pitting or non-pitting edema. Those are some of the investigations. Then the other sign you can do is after you do a fundal examination, there can be retinal hemorrhage. So retinal hemorrhage after you do a fundal examination. Those are some of the signs we have discussed. So then I remember I even made a mnemonic CHREV, which stand for cyanosis, headache, respiratory distress, epigastric pain, visual disturbance, and of course they are you can even put Shrevo for the oliguria and these other symptoms. Okay, so in terms of investigations, can do your full blood count where you check for the levels. I remember there is talk of a HELP syndrome, so full blood count, check for levels of HB levels, hemolysis, so check for platelet counts. You can also do your LFTs where you check for ALT and AST. Alkaline phosphatase level is not usually helpful because it is usually raised in pregnancy. Then the other is you can do U&Ds, so you can do U&Ds to check for kidney function. Then you can also do an OB scan to check the fetal well-being and exclude IUGR. So the OB scan is very helpful here, so that remember your plan is to deliver within 24 hours. So it's going to help you in your management. So this is the end of the SPE, and we have done 3 videos on our channel on disorders of hypertensive disorders in pregnancy. We have 3 videos. Please make sure to check them out. So we separated them in terms of where we introduced the topic, where we talked about preeclampsia, eclampsia, where we just talked about pregnancy-induced hypertension and preeclampsia. Then the last video was where we talked about eclampsia, and finally we also talked about magnesium sulfate administration, toxicity, and a lot of these other things related to eclampsia and magnesium sulfate. And also in the second video for the hypertensive disorders in pregnancy, we also exhausted the pathophysiology of pre-eclampsia. Please make sure to check out that video, because this is a case study for SPE, which is a topic we have already done on the channel. Thank you for watching, and see you in the next tutorial. And please like this video.